Hello, everybody. Thank you for being here. Let's go over some data and then a couple updates on some programs I know some of you had questions about, and then can take some questions. Good news, no new deaths. We've lost 708 of our residents since March 16th of 2020. So we continue to remember them and their families. Our positive rates, so positive rates now are becoming a little bit as kind of a different type of metric. With all the various testing in the community that was taking place, you got a lot of asymptomatic testing, but you got it from a lot of different places, so that's good. Allows you broad-based data from different segments of the community. With a lot of the testing requirements going away for different things and the demand for asymptomatic testing going down, what you're getting is you're getting targeted testing from the same groups of people in the same industry, or you're receiving symptomatic tests. And so if you're sick with COVID symptoms, you have a better chance of having COVID, right? So that's not a great metric. So right now our 7-day average about 1.3%, but our caseloads continue to drop. So that's the good news. Active cases 37,608, or excuse me, positive cases since the whole pandemic 37,608. That's 47 new cases today. Our active cases, which is an important metric, down 34. So we have 260 active cases right now in the county. So this is the lowest we've been in a period of time. So that's really the number we're watching right now. Hospitalizations, another number we watch very closely, 33 in the hospital of our residents, certainly with 6 of them in the ICU. So let's keep these folks in our thoughts and prayers so that they can get home and get well. That number's been around that number for a week, 2 weeks, starting to get, hopefully we can get below 30 this week. We'll see. Vaccination efforts, so our clinics for 12 and over in the schools, we've completed those clinics. This week we're focusing in on vaccinating farm workers, specifically migrant workers coming into the community. And we will be obviously surgical with our vaccination efforts moving forward, focusing in on zip codes where we're underperforming and as it's getting harder and harder to find folks. And we'll go over some of our numbers because really everybody should be quite proud. Any group that wants to have a vaccination clinic, or if you have a homebound neighbor that needs a shot, they can't go somewhere or whatnot, please reach out to us through covidvaccinations@ongov.net. And we will work to get the neighbor vaccinated individually, or certainly if people have ideas and they want to help us organize a small vaccination pop-up clinic, we're all ears and looking to participate. Through May 25th, we have now hit 2 important metrics and milestones. We've hit 60% of our county residents have received their first vaccine dose, and over 70% of the 18 and above population have received the first dose. These are really important. Obviously, the 70% number is getting awfully close to where most epidemiologists think we will really start to see that herd immunity pop in. But that 60% number is very good. Remember, what this does not take into consideration is natural immunity from those who have had the virus and still are immune. So that's important. So job well done. I want to personally thank all of the partners who have been vaccinating over the last few months, from the state of New York to all of our nurses, our hospitals, our healthcare workers in Essentia Health, our pharmacies, our team of volunteers and nurses, and our health department here. Amazing work, probably the most important thing we'll ever do in these roles, and we're doing really well. And that's why we're seeing this pandemic turn the corner. Percentages of first doses in Onondaga County: 12 to 15 years old, 21.7%. 16 to 19 years of age, 39.9%. 20 to 29, 47.3%. 30 to 39, 53.3%. 40 to 49, 57.4%. 50 to 59, 64.2%. 60 to 69, 81.4%. 70 to 79, 92.9%. And 80 plus, 78.2%. When you look at the totals, 60.3% countywide, first dose, completed series, 49.9% totals. And again, out of the 18 and above, we're over 70. I think we're probably at 71%, right around there. So great job. Members of the community, great job. All of our credible messengers, thank you for what you've done. Keeping it local, our restaurant gift card program, we will be finishing up round one, right? This won't be the official round two, but it will be a second offering. We did have some restaurants just put in their vouchers late today, so we will redeem those, so our numbers might be a little different. But let's do it this way. For restaurants that want to participate in this next series or opt out of the program, you have till May 28th through June 4th to opt in or opt out. Believe it or not, some wanted to opt out, I'm told. Beginning on Monday, June 7th at 7 p.m., the public can go to www.ongoved.com/keepingitlocal and redeem more vouchers. Beginning on Tuesday, June 8th at 11 a.m., we will leave an allotment for our seniors where individuals can call our senior voucher line at 315-218-1987. So whatever's left from the first round, we're going to take 75% of that, and anybody can go compete for that online. We will then take 25% of that number, and we think the number is at least $100,000. We'll take 25% of that number, and then we will allocate that for seniors to call in for vouchers, and then our teams will mail them the vouchers, so that if seniors had a hard time with technology, this is a way they can participate in the program. You will then need to redeem your vouchers at your favorite restaurant June 8th through June 23rd. That will be our next series of this. We then believe we will do another round, another full round in the near future as well. So again, key dates here: Monday, June 7th, 7 p.m. We picked 7 p.m. so everybody can, hopefully most people aren't working. They'll have an opportunity to go online. June 8th, 11 a.m., you can call 218-1987 if you're 65 and above, and take advantage of vouchers via the phone with our teams. A couple other things, just from a mental standpoint here, we're turning the corner on this pandemic. We're doing much better through this country at every metric. It's time for our businesses to bring people back to work. And it's time for our downtowns to come back to life. And so I encourage business owners, if you have questions about how you can do this safely, reach out to our teams. But it's time. Psychologically, it's tough. We've been through a lot. We've been through a lot of trauma, a lot of fear, a lot of anxiety, but we've accomplished so much. And now the next step for us to recover is we got to take the next step forward. And that means we got to get our downtowns, our main streets alive again. We need people coming back to work in the offices. So I encourage our business community to take their county executive's advice on this. Let's get back to work. Let's get rolling here. May is Skin Cancer Awareness Month. Skin cancer is America's most common cancer. Unfortunately, one of the most preventable. We have a program of sunscreen dispenser stations. The Onondaga County Health Department, Upstate Medical Center, and our parks have partnered to install these dispensers at various locations through county parks. So please, when you are, and as well at the Rosamond Gifford Zoo, Oneida Shores, Willow Bay, shuffleboard courts at Onondaga Lake Park, and in our boat launch. Please, please, please utilize sunscreen on your little ones and on yourself. Some of us burn easier than others, and again, this is a preventable situation. Please take advantage of that when you enjoy our park system. Happy to take questions.
Ryan, are you planning any more mass vaccination clinics here?
Not at this moment, not until we get either another influx of eligibility or booster shots, which we have heard nothing about. But certainly those would be the two things that would trigger more mass vaccination sites. So when that happens, we'll do it. But until then, we're probably going to, you know, I just got updated zip code data. I have communities that are still lagging behind, and that's where our efforts will probably be with pop-up clinics. You know, we've made some ground in some of these areas, you know, but we have communities that are 67% vaccinated, and then we have communities that, you know, are still in the 30s in some of our city zip codes. So we got work to do still there. That's where we'll go.
Yeah, it's starting to feel like, you know, we're almost done, but I'm just wondering, do you have a target number? We've just crossed 70% of adults. I mean, do you have a target number you'd like to hit?
Well, so Tim, I think yeah, I mean, I think the adults, you're probably not going to grow that much more. I mean, I think through some of our targeted efforts, we can probably get them there. I think these younger demos, we got room to grow still. But I really want to see what happens with this virus. So let me give you this data point. So 16 and 19 years old, 39.9%, right? So by the end of the day, we'll be at 40% with that demo. But we have a 30.7% completed series percentage there. So we have some immunity building there. The 12 to 15, we still got room. So we're at 21.7% first dose. We don't have anybody with a completed series yet. So I'm really interested in seeing, as we get more of that demo vaccinated, because they're the ones that get it, that give it to their little siblings. Once we get these second shots there, what do we see with these numbers? And that's where I think we might see a pretty substantial drop as well. But when you look at these numbers, where's there more room to grow? You know, we got some areas still where we can go and get back out there in these neighborhoods and try to make it easy with our credible messengers and just try to keep nipping away. But I think if we, you know, before the next eligibility group opens up, if you can get to a 65% number, total countywide population, I think we're doing really well.
Which zip codes are still on the low end?
Yeah, so 13204 is the lowest still, although it's improved since last time we talked about. That's 31.8%. 03, 34.2. 08, 35.1. 05, 37.3. 10, 38.2. So those are the city zip codes we would go back into. Skaneateles Falls, lowest suburban zip code. Salina, you know, got a little bit better. We could probably go back there as well. But these other ones are getting closer to 50. So we got still some rural work to do, and certainly we got to do better in some of these city zip codes.
How often, or what are the plans to have some more pop-up sites? And given that we won't be having more regularly it happening, you know, the mass vaccination sites here, are there any talks about having a more permanent setup in some of these areas?
Yeah, we'll look at it. I think the key is you don't having a permanent site. If you don't have people really pushing, people to the site, it becomes, you know, almost a exercise in futility, right? So the key is you get partners that want to work with you in these areas, and you get credible messengers. We're gonna, we've gotten creative with incentives. There's other incentives out there right now that the state's done, and maybe that will help a little bit. I know if you are thinking about paying for your kids' college, which certainly I am. That the governor's SUNY college incentive was interesting. So there's different things that people are doing now. But again, I think if it's an access issue, we just got to get more creative. We got to be there. If we get a stretch of good weather, maybe going in to streets in these areas and blocking off streets, working with the city. But I think that's what we have to do now. It's having these mass vac sites, you pay a lot of people to sit there, and they're not doing much, right?
Are we kind of stuck in this area where we're going to have 40 or 50 new cases a day and 30 people in the hospital?
I think we're going to do better on the cases, Tim. I think we'll hopefully get to that 30 to 40 range. I mean, today's usually today and tomorrow are usually our large days, I think, and the new way that the testing breaks down. But yeah, I think once we get through these 12 to 15-year-olds more, when they have the completed series, I think that's when we can maybe see these caseloads get down in the 20s on a daily basis. That would be my educated assumption right now. But we're getting there. I mean, it's unfortunately there is some hesitancy out there that I don't think we're going to break through. But I think there is still kind of I think access still is a driving factor to some of this. I was with county executives from across the state yesterday, and the mayor of New York as well for a long period of time, and we shared our stories, what works and what doesn't work. And the mayor of New York was suggesting that unique access opportunities to people has helped them with some of their efforts. So certainly I think we'll look to learn from some of their efforts and try to use those in our city.
And have you been out to the 13204 since was the Fowler High School
Yep.
clinic the last one there?
Yep.
Do you know when you might be there again? Not necessarily at Fowler, but in the area.
Yeah, right now we're focused in on we've already set up some of our agricultural workers throughout this week. We'll debrief, with what our plan is going into next week, and certainly this will be the focus. Again, but you can't just go to a building in the 13204 and think anything's going to happen if you don't have a strategic effort to drive output. So you need your partners to work with you. So it's better to have a well thought out plan when you do that. And so certainly we know where there's work to do still, and we'll be doing it.
Do you have any update on how much rental assistance has gone out the door?
I haven't seen the latest number, Tim. I know it was six figures. I don't know how far up on the six figures it is right now. I know we're probably 30 to 60 to 90 days ahead of where our partners in New York State are.
Are you still ordering more doses of the vaccine in, or are we happy with the supply that we have at the moment?
Yeah, supply is not an issue anywhere. So right now, I believe we still have supply we need, and certainly if we need more, we can get more. But the supply is absolutely not an issue for anyone, anywhere.
How many doses does the county have at the moment?
I haven't got that number right now. Yeah. It's thousands would be my assumption. Other questions?
Anything new on your strategic initiatives? Have you hired the deputies yet? Or?
We have not hired deputies. We're working through on our plans, the projects we talked about. We're going to be kicking off a couple of them shortly that are more community-based. I'm we'll probably be out and looking at our village town center efforts later next week. When you look at our road plan, our team is going to do more miles of road. And again, so everybody understands what you can use this money for from the federal money. You can use, if you replace your lost revenue, which they give you a formula, that's your money, right? You can use that any way you want. Other than that, you can use it for broadband, sewer, or water infrastructure, targeted support for industry that's been impacted. You can use it for housing and nonprofit support. So we'll, remember, we put in our own local dollars into this as well. So that's funding that we can use for anything. But right now, our road, we put essentially a $20 million road plan forward, $15 million of local funds, $5 million of stimulus funds through revenue replacement. We will be announcing our second phase of our Village and Main Street program and Town Center planning programs in the near future. We are working diligently on finalizing a presentation for the legislature for a multi-sports tourism complex. The concept there to draw teams and sports teams into the community so that then they come and spend money here. They eat at our restaurants. They stay at our hotels. There's been no industry hit harder than our hospitality industry in this pandemic. We have our mental health initiative with our school districts where we're putting mental health clinics in every building. We will provide a competitive process to nonprofits to come in for initiative-driven applications related to our poverty platform. And then we have, certainly, we've talked about the Carnegie building being renovated. We've talked about improvements at the convention center. We've talked about support for film, support for tourism, and we still have some more things we're going to do that you'll have to wait to hear about because they will be very big, and you guys will love them. So that's what Isabel Harris is working on. But we won't rush any of the deputies. We'll find the right people, and then they'll be very, very busy. Other questions?
When it comes to the county government's operations now, is it back at full capacity with regard to bringing anyone back that was furloughed or anything like that?
Yeah, we've been back at full capacity since March 31st. And so, and again, we've, we brought on, some legislators had concerns about different positions in departments. We brought on 50 positions. I mean, so the reality is the job's getting done. We're in a good spot. Like anything in a pandemic, like any operation or organization, you learn about yourself, right? And you learn about things. And, we were forced to make staffing decisions, not just with furloughs and 103 employees, but we had retirement incentives. And one of the things we learned is that we lost a lot of people to retirement, and we've brought back some of those. But right now, we don't need to bring back the other retirement positions. We're getting the job done. So, it's always about doing more with less in government. This isn't our personal money. This is your money. And that's what we do here in Onondaga County. We're doing more with less, and we'll continue to do more with less. But when we have issues, especially some of these pandemic-driven issues that we just haven't focused in on because we're focused in on the actual virus and how it gets us sick, certainly there will be areas that pop up that we'll have to invest more in. And we will. We'll spend the next 12 months dealing and recognizing a lot of damage that we really weren't focused in on over the last 16 months. Other questions? Okay. Thanks, everybody. We'll see you next week.